Hello and welcome to this special show on Rajya Sabha Television. I am Vishal Dahiya and here we talk about India's fight against COVID-19. And in this fight, most important aspect are our health workers, the doctors, the nurses who are working on the front line to try and ensure that we stay safe, or those of us who do get a positive, that is COVID positive, they get required treatment and also all the required medical help and facilities as well. But most important question here, and something which we're going to talk about today, is how to protect these health workers and what is being done. What more needs to be done, if at all there is a room for improvement? For more on this, we joined by a distinguished panel of guests. Let me first introduce them to you, beginning with Dr. Rajan Sharma. He's the National President of Indian Medical Association. We also have with us Dr. Balvinder Singh, the Medical Superintendent of Safdarjung Hospital in the National Capital. And we're also joined by Dr. Rajiv Garg, the Director General of Health Services in the Ministry of Health and Family Welfare. Welcome all of you to Rajya Sabha TV studios. Let me begin with you, Dr. Sharma, and let's start by taking an overview of what has been the experience so far in this fight against COVID-19 as a health professional, and also in terms of what are we doing to protect our health workers.
Vishal, first of all, let me begin with thanking you and Rajya Sabha TV to have an all doctors panel to discuss the problems of the doctors. And the safety and concern of the doctors is a national issue and it cannot vary from state to state. What I see is the doctor as an institution and his voice being unheard. Safety of our healthcare professionals and doctors, resident doctors, nurses and healthcare workers should be of prime concern when I see so many countries just focusing on that. Let the doctors, resident doctors decide, and the government and the implementing authorities all across the nation should have one policy guideline, and there should be extensive coverage on donning and doffing of the PPE kit, because I still feel that this high infection rate can be because of two reasons. One, problem in donning, not donning, but doffing. And second, we need to revisit the PPE kits quality, which is available. Also, when you ask for protection, it is like providing a cocoon to the healthcare community. You provide for their personal safety, their financial security, and their working security. Take care of their nutrition and immunity. We talk a lot about immunity, but the healthcare professionals' immunity and in working actively in government duties, in COVID duty, is our responsibility. And we have to work together inclusively. I always believe criticizing anything is very easy, but finding a practical solution to that problem is the most difficult. So let's all put to the heads together and find a solution to our future. That is the resident doctors, any person who is on active COVID duty. Thank you so much.
Okay, definitely. That's, the spirit out there, and we'll take all these aspects one by one in terms of insurance, in terms of PPE kit, the training as well. Let me come to Dr. Balvinder Singh here. Dr. Singh, you're one of the senior doctors who's involved in this particular battle against COVID-19 on the front lines. So share your experience with us firsthand as to how the days or nights usually, or the entire sequence situation usually is, and obviously the protection aspect of it for the health workers.
Thank you, Mr. Vishal. First of all, thanks a lot to you as well as your Rajya Sabha TV, and thanks for asking this question. Now, healthcare workers, their safety, of course, is a prime concern, should be a prime concern. As a head of the institution, I had fixed certain goals. The very first goal was that I created 4 teams, 4 to 5 teams. The first team which I created was just to take care of the training and education about the donning and doffing of the PPE kit, because there, it started in Wuhan, and since then I had been myself constantly, trying to learn a lot from the experience of other countries. So about the donning and doffing, we started initially training, and we immediately went to as a virtual training. And this virtual training of donning and doffing, I started with all the cadres of doctors who were to go on the duty, especially the senior resident doctors, junior resident doctors, and even interns also. Now, it is not just that donning and doffing is the protection, but basic do's and don'ts. You have to time and again, like, continuing medical education, you have to time and again remind them, look, it is very important and you must stick to it. Sometimes, you have to be a little strict towards them. So I used to personally go and supervise. The other aspect about the safety of the healthcare workers was, which I think very few hospitals may have taken it up or not, I just gave them a kind of counseling to them about, like, if they develop the clinical picture or any signs and symptoms of that. Sometimes, we doctors are so overworked, working day and night, they themselves not would care about themselves. They're so dedicated. So I created a task force. That task force was to, look into the problems of all the doctors who are actually working in the COVID block. Now, Safdarjung Hospital is a huge hospital, like a city inside another city. We have a non-COVID area where other patients are also being treated in follow-up cases, and other one, the so-called fresh registrations were also going in. The COVID block was a huge. It's another hospital in my hospital. So at the very outside, I decided that no COVID patient will be allowed to be seen, treated, or will be allowed to enter into the non-COVID part of the hospital. It has to go into the COVID block through a separate route, and it has to be supervised. Now the question arises, patients are bound to come. So for their sort of segregation of services, I did, to be very precise. Fever screening, cleaning were in separate location. In emergency, we used to do triaging. Like once a patient comes, you quickly do the assessment and decide where to go, to the COVID area or non-COVID area. Now this is one. So first is training and education. Second was delineating the service areas, where to go, where not to go. Third is the very important aspect, taking care of the morale of these doctors, psychological, as we are all humans. So I also engaged some of my senior consultant level persons who are the plus 62 years of age, like, they have the administrative experience, they have the experience of teaching these doctors. So taking care of their morale is absolutely very important. None of them should go into a kind of a feeling of isolation, or feeling, that they are overstressed, nobody's bothering, nobody's talking to them. So I would personally call many of them in the teams and talk to them in my committee room, observing the social distancing. Now, look, after this, very important is their physical security. For physical security, fortunately, in Safdarjung Hospital, we have got security guards which are fairly good enough in number, more than around 1,500. But the security guards are just a deterrent. Very important is to have the marshals. So I appointed quite a number of marshals, and made the marshals get posted, at all critical points where I know the patient is going to go there with a relative and there is a risk. So those marshals were of great help to me, and I just definitely gave, and even the marshals also, and the security staff in the entire hospital. I will take the round. Now, last of all was that, which I would recommend to some other hospitals, which nobody has done in hospital. There are many patients who are admitted for more than 48 hours in the hospital. So I also gave passed in a cautionary advisory note that all the patients who are, admitted for a longer period, more than 2 days in the hospital, they all have to be tested for the COVID testing to safeguard against the spread of COVID-19 outbreak within my hospital itself. So they have all been gone. The moment we get any positive, I'm shifting them to the COVID block. So on the whole, I will say that these are the 4 or 5 major areas which, as a head of institution, is my responsibility, and I have taken care of it.
Okay, definitely. These are really, really important aspects. And the way you have described this, Dr. Singh, is perhaps a good model there as well, to ensure not only the physical well-being, that's a physical safety and security, but also the moral health of the health workers, doctors there on the front line, and obviously education and training there as well. Let me bring in Dr. Rajiv Garg here from Director General of Health Services. Dr. Garg, from the government's perspective, what are the key guidelines which needs to be followed by all hospitals or the health institutions in terms of ensuring the protection of health workers, be it doctors, nurses, or all others who are involved on the front line?
Thank you, Vishal. First of all, I think this is a good at this juncture by the Rajya Sabha TV to bring out this topic, because this is a burning topic of today. And as you know, the country is fighting against an unknown disease or COVID-19, many aspects of which we don't know. So basically, we are talking about the core team in this fight, which are our healthcare providers. And they have been up and about right from the middle of March right up to here. First, we started the preventive steps, as the whole country knows, and then we got the patient. The first patient came the first week of February, and then gradually the numbers are rising as expected in an epidemic, rather a pandemic. So, as we know that we are dealing with the agent which is contaminating through the body fluids, particularly the respiratory secretions. So how to protect the healthcare providers basically is to stop the droplet infection, which is containing this contaminant. And therefore, we have issued a number of guidelines for the healthcare workers in different settings, whether we are working in the COVID wards or the non-COVID wards, and how to take care of yourself. Because ultimately, your health is very important, the health of the healthcare providers. They are the core team in this. And as Dr. Balvinder said, that the training aspect is very important. How to put on the PPE or the personal protective equipment, how to doff it, and how to wash hands after that, or even take a shower. So all this is part of the training exercise, and the guidelines issued by the ministry contain all these as a handy guidebook on the website, and otherwise the hospitals have also circulated them, and they have training sessions. So that is the way we are tackling it, and to remove the fear factor, because many healthcare workers have a lot of fear about this disease. But as logically and as empirically, we can remove this fear, and they can go on with their good work they are doing. Thank you.
Okay. Dr. Garg, is your department or the ministry satisfied with the way all these guidelines are being followed at all levels, be it in government hospitals or private hospitals, specifically with respect to training in terms of, how to go about treating the COVID-19 patients, and obviously keeping themselves safe, use of safety gear as well?
Yes, we are monitoring it, and our state, the chief secretaries, they always, when we talk on the VC with them, they also monitor this through their, down the line, they have the hospital MSAs or even at the CHC levels and the other levels. And if they need any equipment, if there is, we are procuring a lot of PPEs and we are sending it to the states. We have the guidance documents. We have the phone lines available, where any person who has some doubt whether he is exposed or is not exposed, and so we have a kind of a 24/7 availability of a control room for all this.
Okay, and Dr. Rajan also suggested, in his initial comments about having a uniformity on the guidelines at all levels, center, state, or district level as well. So, is there something being done to ensure that uniformity of guidelines as well? Sometimes it happens that there is some discrepancy at certain levels. How do you address that?
Yes, naturally, we are very worried if they are not being followed. So, we always issue the instructions that these guidelines have to be followed. You can increase at your level. You cannot go below the standards. So therefore, we will always keep monitoring, and I think most of the hospitals are following it, because they also have the same, feelings as we have at the center.
Here I would like to add something.
Please, Dr. Singh.
What happens is that, as Dr. Rajiv Garg very rightly said, that guidelines have been, of course, made by the experts, and there is always a concern whether these guidelines are being followed or not. But at the same time, there were some people in some quarters, if you see, that there was some people had some problems like guideline should be changed. This guideline is like this. New guideline has come, but many times people fail to realize that it's a pandemic we are facing. As the pandemic evolves, a disease evolves, we also have to keep a watch, and the guideline has to be modified, it has to be revised, it has to be reviewed. I think ministry has very rightly done in many cases, especially like the testing strategy for the COVID-19. It has to be revised because if the pandemic is evolving, there's a particular trend is emerging. And if you keep sticking to, one guideline which you feel is not sufficient, why not amend it? Why not review it? So some
Okay.
guidelines are supposed to be, uniform throughout, and other guidelines have to be, modified as the situation evolves.
Definitely. It is an evolving and a very dynamic situation. And as both of you are pointing out, obviously, we will have to keep, tweaking our strategy to deal with this particular pandemic as we learn more about the virus and other aspects as well. Dr. Rajan, you initially spoke about how, solutions need to be found about, and there can be a constructive criticism as well. So in terms of what is being done right now and what needs to be done, is there a gap which needs to be bridged? And if so, how can that be done?
See, Vishal, we should be very clear. It is the doctor, nurses, and healthcare workers who have to fight this battle. And Dr. Balvinder is there, Dr. Rajiv, our DGHS is there. And it is our DGHS who has to lead the battle from the front. And we have to aid him and support him and augment his strength. But yes, I still say a doctor has, as an institution, as a treater, as a planner, has to be respected, and the time to revisit Indian medical services, and also a doctor who has to work in such hard circumstances, his financial security has to be ensured by everybody across the country. No doctor should today, whether it is a resident or a intern or any doctor who's called for COVID duty, these 2 months are so crucial that we should pull out all stops to ensure a safe delivery of things. No procedure, no rule can impede that when such senior people decide. And let's get together our act. We started very well. Now again I still say our DGHS sir has to take a command again to lead the states with guidelines, very clear guidelines, because he has risen from the ranks. And we are ready to augment his initiatives whenever required.
Okay. That's Dr. Garg, your response on that?
Yeah, I totally agree. We have started with a very good, response by our healthcare teams, and we are in the ministry always devoted to the same line as we started with, and therefore we have made, the MS of a major hospital in New Delhi is sitting with us. So we have provided them, an active quarantine. That means the healthcare providers are staying in hotels or in the good accommodations provided by the various hospitals in Delhi at least, so that they don't go back to their families. They stay in a separate room, and post duty they get good nutrition, they get good entertainment. TV there is there in most of the rooms, and they have other Wi-Fi and other facilities. And when they go back to the hospital, they are fresh again and they are able to do the correct procedures required on the patients. And when we come back, when they are off duty, they are given all the protection required. So we are taking care of them.
And the other two aspects which Dr. Rajan also pointed out in terms of financial stability, financial security, all stops need to be pulled out here. Perhaps a bit of a tweak in the rule book as well, because this is a unique situation. It's a pandemic, and doctors like all of you and all others out there, they're the real warriors out there, fighting it on the front line.
I agree with Dr. Rajan that financially there should be no stopping of salaries and wages, and the full protection in terms of finance should be provided. And in some ways we'll always incentivize them, because when the patients these flights were coming from abroad and they were put on extra duties, we were giving them some incentive also in the airports all over the country. So we have always been looking after them.
Okay, and perhaps all these steps should be also followed uniformly across the country by all hospitals, be the government or the private as well. Let's have concluding comments from Dr. Singh here. Dr. Singh, in terms of what more can be done, because obviously it is going to be an evolving situation as you pointed out, and we will have to keep on tweaking our strategies.
Yeah, this is absolutely very, very interesting question you have asked. There is a lot of panic going on in the society. It is very clear the number of cases are rising, in a very sort of very high rise in number of cases and deaths also. But what I am able to observe is that there are two things very important. The first is there is a strange kind of phobic psychosis, mass psychosis is there. People are, very much afraid. That fear psychosis, has to be removed. Now, for removing that fear psychosis, I would say that media has got a tremendous role. I here have a reservation. If you look on the media, most of the time they are talking about the conflict between the center and state government, or they are talking about number they are showing. But there are very rarely I have seen any shows which reflect that how to remove this kind of fear psychosis among the masses, the common man. This has to be taken up by the media very seriously. And the other thing is, as you said, situation is evolving. As of course I said that situation is evolving. Large number of cases are occurring, and deaths, of course, are in proportion bound to happen. Here it is to be kept in mind that mortality, the death rate is very high in the people who are above 60 years of age. For that, central government, of course, in my hospitals, I would say that very nice. A lot of support has come to us. Like we have got the ventilators also now. We have been able to increase our ICU beds also, general beds also. The similar kind of strategy should be applied to almost every hospital of Delhi government as well as other central government hospitals, which in fact we are trying to gear up. But I would still say that last of all, it's a very important point to add that people need to understand that if you are like hearing us, try to understand, never go into any panic reaction, because during these days, in addition to corona, the pandemic, the dengue infection, chikungunya, malaria, typhoid, these kind of infections do happen. So if you just get, say, mild symptoms of tiredness, fever or cough, it doesn't mean that you have got a corona. And don't rush to the hospitals immediately. It unduly, it increases stress on the medical services as well as, panic among the doctors. They are welcome. They should have teleconsultation, for which government should allow. And they can, take basic means. The awareness must be there, generated among the masses through media. Just in case of minor illnesses, they may consult their doctor and stay at home. And I think these are the two aspects which I would like to definitely consider if I am in place to, if I am given the authority to,
Okay. Yeah. Thank you so much, Dr. Balvinder Singh, Dr. Rajan Sharma, and Dr. Rajiv Garg there for sharing your views with us on this very important aspect of India's fight against COVID-19. So as our panelists are pointing out, the doctors or nurses or any other form of healthcare workers are our frontline warriors in this fight against COVID-19, and all should be done to ensure that not only it is their physical safety which is considered or secured, but also the financial security, their security while they are working on the ground, they are in hospitals treating patients in terms of training, education, and their protection kits as well. Something which the guidelines by the Health Ministry and by other state governments are also taken care of. Hopefully, there will be a uniformity in all these guidelines and they will be followed in letter and spirit by all those concerned. We'll come back again tomorrow with a different topic. Till then, you keep watching Rajya Sabha television and don't forget to follow all the norms with respect to social distancing and also put on a mask when you step out of your house. Thank you.